Let's get rid of much of the DEI programs in health and medicine and replace them by completely overhauling our incentive structures. Please see my disclaimer at the end of this short video. I'm Dr. Chad Swanson. I'm an emergency physician, and this is my daily health systems transformation video. Imagine a community of maybe 3 million people with a university and hospital system and public health. And then imagine that each professional, so emergency physicians like myself, family practice physicians, nurses, even health unit secretaries, even the environmental staff, but also the public health professionals, the university health professionals, and even the politicians. Imagine that we're all paid on salary with an average income equal to other professionals in our area. And then imagine that there is an incentive, financial incentive built in, where you can make up to 30% more and 30% less, depending on metrics that represent the overall health and well-being of the community in which we work. So metrics perhaps such as life expectancy, of course, but also maternal mortality of Black women, or our metabolic health, maybe insulin resistance, but also metrics related to equity and metrics related to efficiency. There might be 100 or a few hundred total metrics, and a dozen or so of those metrics could be chosen randomly. And then all of the professionals would be either incentivized or disincentivized based on the overall health and well-being of the community and the ability of the health system to deliver health and well-being at the lowest possible cost. Non-financial incentives could be used as well, whether it be the job security or scheduling or celebrating successes. So essentially, I envision doing away with as many committees, incentive structures, and metrics that are not oriented towards what we want the most. So we certainly don't want a large volume of sick people, so we do away with fee-for-service. We certainly do not want a large number of publications in our universities if they're not improving health. I think we need to, as much as possible, orient our incentive structures towards what we want the most, and then allow organizations and individuals to adapt and innovate in surprising ways, perhaps, to reach what we want as a society the most. It is absolutely unacceptable that our Black mothers are dying in rates that they are, and so we need to set up incentive structures so that simply does not happen. My disclaimer is that I view these videos as an opportunity for me to view the health system from a bird's eye perspective. I'm an emergency physician. I also am writing some history, and I have some expertise in complex systems, and I have a master's in public health. But I'm most interested in sparking conversation in a real way about important issues than I am coming up with specific solutions. And so I think we need to relentlessly stay focused on what we want the most, which is optimal health and well-being for all at the lowest cost to the system. I'd love your thoughts, perspective, and criticism. Thank you.